It's Tina,
And Whitney.
and this is The Joy Within the Journey from Nurse Leadership Solutions. And we are going to talk today about nursing facility visit checklist.
I have the perfect story for this.
You do?
I do.
All right.
It's a
Well,
perfect topic today.
let's just roll right on into it. Um, actually, Whitney created this checklist. And we were talking one day about additional resources we can provide. And one of the things, if you go to our website, you'll see that this nursing facility visit checklist has been uploaded there to share. You can print it off for yourself because families sometimes ask me, would you go visit this building for me? Would you tell me which one I should go to? And I recently just visited a couple buildings for a family member. And, I just go in with a different view maybe sometimes than everybody else does because it's not always about how it looks. It doesn't have to be the Taj Mahal or it doesn't not everything's going to be perfect or whatever. So I like to be involved in these things for people that are close to me and helping them pick the right location to go to. So I appreciate you putting this list together and sharing it with everybody.
Mhm.
But let's start with your story.
So I had a hospital shift yesterday, and keep in mind I've been out of long-term care for,
A short time.
five-ish years now, something like that. And I had a patient, and the patient was being discharged today. So families being notified, hey, your loved one's going to be discharged tomorrow. They're going to need some rehab at a long-term care facility. Um, Let me know which one you want. And the family's like, what do you mean? Where do I go? What do I pick? And they were provided with a list, like just printed off of the computer. Here's a list of some long-term care communities. Here's their star rating, but didn't, go into a lot of detail about what a star rating is and where those numbers come from and how they get that rating. And let me know which one you want. And the daughter was just in distress. She's like, I have until tomorrow to make this decision. What? I don't, how am I going to pick where my
Off a piece of
mom
paper.
is going to go off of a piece of paper by tomorrow when you say that you're discharging her? And that's just the difference in the hospital world and long-term care world, the world that we're used to that would never be acceptable. But in the hospital, that's just how it is. You come in, we fix you, you go home or go wherever you need to go.
The
Like that's
long-term plan
just
isn't your problem, or
that's
the whole person isn't. I mean, I hate to say it, but I
but
view it as
it's
the whole
yeah,
person isn't your problem either. You're really there for whatever their
their diagnosis.
their diagnosis is, and
We
then to go home.
yes. Which isn't it's not what I'm used to.
Yeah.
So I was able to spend some time with my patient and her daughter and other family members and just gave them a little bit of my personal advice. I let them know a little bit about my history and long term care. And, that was a passion of mine. And I too had to find somewhere for my loved ones before. And this is how I picked, and this is what I would do. And they thanked me over and over and over again, for the information. I gave them my personal references of or recommendations of some buildings. And they were very overwhelmed. My heart was instantly broken for them because they wanted to make the right decision for their mom and had very little time or knowledge
And what to do.
what to do.
Mhm.
So one of the biggest things I said is you can't pick a building until you go in and see that building. You have to base your judgment off of first impressions, I feel. What is your first impression when you walk into a building? And then that's where we can lead into our
The
list here.
checklist.
Yeah.
So, again, this is a checklist for if you're going to visit, whether it's assisted living, skilled nursing, there are differences. And of course, we can help with that too. But, overall, this one is just talking about touring nursing homes. But it works the same in most instances of
Mhm.
what you're looking for. So, and you have to know that you are at the right, do a little research because you don't want to go in assisted living if you really need nursing care, especially if you've been in the hospital. and Medicare, it has some benefits that you can get some rehab. You need to be at a nursing home um, because assisted living cannot provide you the same benefits and the same care. And I know a lot of people will be like, oh, I would rather go to the assisted living, but that you should not. You should go. Seniors need more acute therapy in
Mhm.
order to be able to get better faster because the slower you get to rehab, the more chances you're not going to get back what you get. So, especially in your case where you're at the hospital, you might have been there for 3 midnights if it's standard Medicare. You really need to go to a nursing home. Just take the days that you get it. You can go to assisted living afterwards, but take the rehab that you're going to get. There's so many benefits to it. So don't cut your rehab time short by going assisted living first if you've been in the hospital for a approved Medicare stay.
And a lot of times those benefits won't even cover assisted living. So if you
They don't cover assisted living at all, but assisted livings will take you thinking that you're in a better setting,
yeah.
but it's not. You need the
Mm,
intensive therapy. You can get some of the same benefits, but they're not covered the same. Medicare doesn't cover them the same. You don't get the extension that you need in order for it to happen. Just do the nursing home so you can get better faster. And then you have more potential to rehab back to where your current level of care is. So, the first thing on the list is resident experience. So that's where the first impressions to me come in the
mhm.
first place is I don't want to see it. And we're not talking about, like I walked in the building. And again, to me, the Taj Mahal doesn't mean anything to me. It's a big fancy building. That means a lot of people put a lot of money in the building, but that doesn't mean that people are being cared for any better on the inside. So are the residents clean, well dressed, and cared for? It makes me crazy. When I'm 90 years old, I might want to lounge around in my PJs all day long, but we all know that if you get up, one of my things is I get up every day. I have the same routine. I'm a very routine person. I put on my makeup. I usually put on my lipstick. I mean, I am
First you shower.
First I shower. Yes, first I shower. Then I put on my makeup, or put on my clothes. I put on clothes too. Then my makeup, lipstick. I do it all. No matter if I'm walking out and sitting at my desk, if I have no calls that day, no matter what I'm doing, I do the same thing. Because if you are clean, well dressed, and cared for by yourself or someone else, you feel better.
Mhm. You
So
look good, you feel good.
it makes me crazy when I go in and see everybody in their PJs or hospital gowns or whatever the case may be. Those residents need to get up and be clean, well dressed, and cared for from the beginning of the day. You might not feel good and want to stay in your PJs occasionally, but if you see a lot of people in their PJs, that means they're not getting proper morning care. And I hate to say that, but I feel
Mine
that
is the
that is
bedhead.
the bad head. Oh,
The
makes me
bedhead makes me
crazy.
rage.
It does. All I gotta do is sometimes because a lot of ladies get their hair
Just
done,
a little pick.
just a little pick.
Pick out the
You can use your
bedhead.
fingers,
Yep.
you don't even have to do that. But the bedhead or is there food on their face
On their
from the night
clothes.
before?
Yep.
Oh, that makes me crazy. Um, so making sure that they're well dressed and have clean clothes on and clean face, clean
Matching.
fingernails.
Matching.
Matching
Put
clothes,
matching
yes.
clothes on them for the love
Yes,
of God.
yes. Are the women shaved? I know, I'm sorry, women, I hate to put it out there,
Mm,
but if I am there we have a deal. I'm a little older than Whitney, and I have a couple friends, and I've told them, "Look, I'm older than you, I get whiskers. My whiskers better not be on my face when I'm in the nursing home, because other words, it's her fault."
I will not you're not that much older than me, and I have whiskers
I
too.
know,
I have
but
purse tweezers that go with me
I
everywhere.
know. I will literally pick a spot on my chin. If you see me with a spot on my chin, you just know that I've been obsessing over the fact that I do not want hair on my chin. And I'm sorry, ladies, but we get it. And people in senior care, please shave your women. Like it's terrible. I mean, obviously, it'd be nice to wax it or whatever. But if nothing else, trim the whiskers.
Yes.
That to me is like, I care about that person because I would not want to be sitting there with a beard which I would be. I would be. So please, that is thing number one. And men the same way. If they're, if they don't want facial hair, shave. That to me, that's kind of a big one. I, I,
Yeah.
I think that that is an immediate response to me as I'm looking at that. Are people's people's is a person's, what's, my brain isn't working. Um, is their facial hair maintained?
Yeah.
And I know that seems kind of crazy. Do they have eye boogers? Are their eyes clean? Has their, that which tells you if their face has been washed? So those are things that I'm looking at right out of the gates.
And to
I don't
me, that's
care.
just common sense. Like when you get up in the morning, do you not brush your teeth,
Yes,
wash your
oral
face,
care.
even
Oh,
wipe your
oral
face
care.
down, make sure that your hair looks presentable. Like we should be caring for these individuals how we would take care of ourselves.
And let me be real clear. How I would take care of myself now might not be how a 90-year-old takes care of herself. She might not want to shower every day. She might not want her hair brushed. She might just want that you to run your fingers through it because she gets it done at the beauty shop. It might not be the same, but it needs to be it needs to be enough to maintain. Oral hygiene is a big one,
Yep.
also because not everybody brushes their teeth. I hate to tell you all, not everybody brushes their teeth, but there are ways to go about. There's bath in a bag, where you can just give soapy washcloths to wipe off and wipe your face, wipe your parts that need to be washed. But and there's sponges that you can use if they're got sensitive gums. There's all kinds of things that you can do in order to maintain proper hygiene.
There's no excuse to not do it.
There really isn't. And it really doesn't take any longer because overall you're doing it. You're gonna have to go back to it, or they're gonna end up with something going on that you have to treat. So just do it while you're doing it. So the resident experience, are they engaged and content? So you're walking right in that building and you're not, this is how state surveyors do it now. They walk in and tour that building instantly.
Hmm.
You too. Don't go in and sit in the administrator's office. Go just walk in, say, I immediately want a tour. And I hate to say that. Sorry for my senior care peers, but overall, that's what you need to do. So you know exactly how they are, and don't freak out over things that you're not happy with. There are things that happen, but overall, you want to walk in and take an immediate tour of that building unannounced.
Have the paper, have a pen,
Yep.
take notes.
Hmm. And so, are the resident engaged? Are they sitting bored, or there's no activities happening? Are they treated respectfully by staff? Is there a staff member sitting behind the desk that's like, and they're ignoring the person that's saying something? And sometimes residents do have repetitive behaviors and they get a little numb to those things. And I get it. But overall, are they treating the residents with respect and answering them as they go by or look at them and greet them and those different things? So overall, the very first thing we want you to do is look at that resident experience. How does that resident look and feel in their home? That is their home, and you want to know do they look like they are at home and comfortable.
Hmm.
Staffing and care is the next thing on our list. The staff to resident ratio seems appropriate. This is really hard because everyone is struggling with staffing.
Everyone, everywhere you
It
go.
doesn't matter what industry, it doesn't matter what location, what neighborhood, everyone is struggling with it. So, um, we are are seeing that everywhere, but overall you have to know, is it appropriate? Or can they meet the needs? And do they have a backup plan to meet the needs? So, is there a nurse available on site 24/7? If it is a nursing facility, skilled nursing facility, there should be a nurse available 24/7. Obviously, you know, uh, there's an RN on usually during the day, and it's LPN on the rest of the times. But it's appropriate if you're in a high acuity building. It might be that it's appropriate for an RN to be around the clock. But overall, LPNs can work circles around RNs sometimes. So I'm definitely not knocking one or the other. But you want to make sure that there's a qualified nurse 24/7. Assisted living, there's not a nurse 24/7 in most cases. There is rare that that does happen, but overall, there's not. It depends on the setting. And you want to make sure that's why I say if you just recently been in the hospital, it's good to have your skilled stay so you can get that. So, is there a nurse available 24/7? Are they friendly, attentive, and knowledgeable staff? You know, I want to be greeted. When I'm walking through, I am paying attention whether that staff is going, "Hi, I'm so and so." And I will, if they try to ignore me, I will literally go up and introduce myself and ask them questions
What do you
because
do? How long
what
have
do
you
you
been
do? How
here?
long you been here? And set and see what they
What's
how
your
they
favorite
greet me.
part about this job?
How comfortable are they greeting staff? Because overall, that's going to be your extended family that that's going to be there. So, do staff greet residents by name? Overall, it's best to use their name, but I'm not so against names unless the resident doesn't want to be called that, and I wouldn't know that during a tour. Sometimes the honeys and the granny and different things like, I've had people that really want to be called. I can think of someone immediately off the top of my head that we called Granny, and she wanted to be called Granny. She'd been called Granny forever, and she recognized the name Granny. And so it's not a turnoff for me until I know it's a turn, until I know it should be. Like, hey, I don't want to be called that. Clear process for medical emergencies. That's something I've never asked. Like, what is your process? But overall, how do they handle it? How are they trained? Again, that nurse being there to handle that.
Some buildings, I've been in and out of different buildings teaching classes and stuff,
Hmm.
and some have some pretty crazy processes that I don't know that I would be comfortable with as a family member. One being the the techs, let's say the level 1 med aides, have to contact the nurse on call before sending out a resident by EMS.
Hmm.
I would not be okay with that. Like, if there is a true emergency, I don't need you to wait to get a hold of a nurse on call. I need you to call 911 so I can assure my loved one is taken care of.
True. Well, they should be CPR and first aid certified, so that's where they should be able to be trained well enough to know that if they need to call 911, call 911, and then update the nurse later. Um, so I could see that would being the case. I know that there's a thing about you don't want people going back to the hospital for unnecessary reasons, but if they are trained properly in CPR and first aid management, they should know the difference of call 911 or call the nurse.
Right.
So, to me, that goes back into, are they knowledgeable staff on how they handle that? So you're right. It shouldn't be a one size fits all in
But
that.
a good question to ask when
Yeah,
doing a tour. How do you handle emergency situations? Like,
right.
what is your team responsible for doing in that situation?
On-site physician or medical director. That is very, very rare to have one on site all the time, obviously. But on site, as in visit the building, how regularly is the thing that I guess I really want to know. Do they come every day? Do they come Monday through Friday? Do they only come once a month? Overall, they're required to sign the orders in a skilled setting once a month. And within 7 days, I believe it's still within 7 days of a telephone order or whatever, and of course, most things are electronic these days, so that's really not an issue. But, is there someone that is coming to the building? Because you sure, don't wanna have to go take someone out to the doctor every time that they're sick to be able to get a hold of them. You wanna make sure that that doctor is visiting regularly because, overall, it's, nice, and the fortunate and unfortunate thing is, you have to have an order for everything and skilled, whether it is Tylenol, ibuprofen, Benadryl, things that Mylanta, stupid things that you and I can go to the store and get a script for, or not a script, just
Over the
buy,
counter
just buy
stuff.
over the
Yeah.
counter and just go home and take it. And if you're in a skilled setting, they have to actually call the doctor, get the order it from the pharmacy. Like it is, or if they have a stock supply, it depends on the circumstances and the medication. But overall, they have to have an order for everything. So you want to know that that doctor's present and accountable enough to get orders quickly. And I think that's where it comes into that. And then the medical director has to sign off on all the policies and procedures, just like that emergency protocol. The medical director should be signing off on that. And then, of course, low staff turnover is the last one there. And that one is just a can of worms that, we've talked about before. And it's rare to find a low staff turnover. And what is low now used to be much, much lower when we said low, and now it's higher, but maybe lower than everybody else's still, but regardless, we wanna know that people are not quitting right out of the gates. Because if you have a constant turnover of an entire staff, you can't train them properly in order to maintain regulations and get to know your residents and get to know, "Hey, I know Whitney, wants she wants to be in bed by 7 o'clock to watch her favorite show and go to sleep, and then wants to get up and do her Peloton at 5 o'clock in the morning." Um, it'd be impressive if you're in the nursing home
It
still
would.
doing your Peloton.
That would be fantastic.
Um, but, um, but overall, you don't get to know your residents if your turnover is really high. So it's an appropriate question to ask.
Very. And chances of you finding one with a low staff turnover, like you said, are going to be hard. And I think that just means as a family, you have to step up a little more and be there a little more. If you're not comfortable with the staffing ratios, then you have to work with your family to be more present in that building to make sure that your loved one's getting cared for the way that you want them to.
I totally agree. And so with that question, and it might even, we get down into it, and we kind of talked about it a little bit, is knowledgeable and trained staff. It's okay. It's not okay. But the reality is you have to accept the fact that there's going to be a higher turnover. You're going to see different people all the time in this kind of setting, or any kind of setting really these days. Then your next question would be, more appropriately, is how do you train your new staff? What
Mhm.
does it look like? Um, because if they say, well, oh, we have a week-long training program where they shadow somebody, okay, or we put them on the floor the very next day, I would hope that they would not tell you that. But it's a fair question. How do you
Yeah.
train your new staff to be ready to go to take care of my loved one?
And I think it should be said, and it might just be me. I don't know. But I don't, no one is going to care for your loved one the way that you would care for your loved one. So don't go in to a building like this with the expectation that they are going to care for mom, dad, grandma, and grandpa exactly how
Right.
you would care for mom, dad, grandma, and grandpa. And if that's the expectation that you're looking for, well, then you should probably take them home with you or move in. Move in with them so you can be that caregiver. Ultimately, I think that's what they deserve, is to be taken care of by their family and by loved ones. But not everybody is in that situation. So go into it with an open mind and not with the expectation that they're going to take care of them the way that you would take care of them.
And that's where, which we get into a little family involvement down the line.
I
But
need to quit jumping the gun then.
no, 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 no. I'm getting ready to say now. What you said is where the families needs to connect with the staff and educate the staff, just like they would want. Hey, you know what? My mom really likes this, and you're going to have to say it, and then you're going to have to say it, and then you have to say it, and you have to say it again. You might have to say it to the same person 2 or 3 times, and then you have to say it to everybody else. You can't say it one time and expect it. Oh, next time I come, this is going to be perfect. We are people taking care of people,
Mhm.
which means that's my famous saying about long-term care. We're people taking care of people, which means there's going to be errors
Yes.
and there's going to be complications all the way along the lines. It's just people taking care of people, that you're setting yourself up for failure if you think that, just a teeny tiny bit of communication back and forth is going to solve the problems.
And I think it's really important to build relationships with those caregivers.
Hmm.
That would be important for me if I had to put my mom or dad in a long-term care community. I would want to have a really good relationship with the ones that are taking care of them.
Well, because that's how you're going to get them to care for your loved one like a loved one.
Right.
So. The next one is on cleanliness and safety. So, this is kind of important to me, because I said it doesn't have to look like the Taj Mahal, but it does need to be clean like the Taj Mahal. I
And
don't
smell
know.
good.
Maybe the Taj Mahal isn't clean. I don't honestly know. But but it needs to look good. Now, when you say smell good, because that's what it says, facility looks and smells clean. People do urinate and
Well, they're incontinent.
exercise their
We have a
bowels
lot of
in senior care.
incontinent individuals
A
in
lot of people
long-term
are
care.
incontinent. So guess what? It is occasionally going to smell. And I hate to say that. I'm sorry for everybody that has to understand that. But overall, for lack of better terms, people poop.
Mm,
And you're going to occasionally smell it. And sometimes people pee right on the floor. And sometimes you take them to the bathroom and they don't want to, um, this happens at all ages. You go to the bathroom, you don't have to go to the bathroom. And then you go sit in a chair and you, um, have some incontinence, and then, if 2 hours go by because you just went to the bathroom, and it could be because you have someone with dementia, didn't understand they were supposed to go to the bathroom, didn't understand they were on the toilet, and then they happen to go to the bathroom right then, 2 hours of pee sitting there is gonna occasionally smell.
right.
Now, you don't wanna see that it's soaking through pants. I mean,
It could.
it could, but you'll know if it's happening frequently, it shouldn't soak through pants because those, things are kind of bulky and weird. Um, but it could soak through pants. But you want to know that overall, you shouldn't see wet pants or have a stale urine smell that is like there all the time,
Like it's just been
like it's been
lingering.
lingering.
Yeah.
It shouldn't be there all the time. But don't freak out if it has an occasional smell because you know what? People go to the bathroom.
Yeah.
And if you have, let's say, 20, 30, 40, 50 people going to the bathroom many times a day, there is no way to get that smell out all the time,
Right.
24/7.
But it is a
But
huge turnoff when you walk in the
it is a
door.
huge turnoff, and I think that's what freaks everybody out.
Yeah.
But it shouldn't knock you over. You shouldn't. I visited my first building that my grandmother was in. Actually, you could smell outside the door. It was bad. You'll know the difference of stale urine and fresh urine. I
Yeah.
mean, I hate to say that. I have a nose like nobody's business. I can smell it as soon as I walk in, and my family teases me because I think all the years I've been going around sniffing things. Now it's made my nose so sensitive that I can smell anything anywhere, but overall, you wanna see. I like to go to the bathroom, you know, definitely while you're there, go in and look in, a bathroom to see what does it look like. Do the baseboards. I know that sounds weird, but to me, I wanna see that the edges of the bathroom are clean, not just that someone went and ran a little mop in the middle. I wanna see the edges, because if, let's say, someone is urinating on the floor, it's gonna run to that edge, and it's gonna get stuck in those edges
Mhm.
if you're just doing the edge. So to me, that's like a sign. I know I'm getting into I'm a little OCD too. Um,
A little.
um, nobody ever wanted me to inspect their buildings, but overall, you just want to know that it's being cleaned up properly, and that it looks clean. It's okay for it to occasionally smell because of freshness of a situation, but overall, you want to know that it's clean. Handrails and safety features in place, if the handrails are falling off, the clutter and the hazards. I hate walking in and there's carts and barrels and everything down the hallways. It makes me crazy. They should not be blocking the handrails because people need handrails. If not even for the residents, for the visitors that are coming to see the residents, a lot of times are elderly also. So you want to make sure that there's not hazards and clutters. And emergency call bells in rooms and bathrooms, really, the emergency call bells, they should all be there because that's a regulation, but I wanna know, are they answered? I mentioned on the last episode that I struggle with watching them go off for moments and minutes, and I have even visited a building where I answer the call light sometimes, because just because 'cause I'm like, "Are you okay?" Because 'Cause I'm worried that you're not gonna be okay because it's been 30 minutes. I mean, emergencies do happen that people can't get there, but overall, when a senior has to go to the bathroom, they have to go to the bathroom. When I have to go to the bathroom, I have to go to the bathroom now, and, you wanna make sure that they're getting that assistance because that's what creates the incontinence, that's what creates the urinary tract infections, and that's what if they can't get to the bathroom, and most importantly, that's what create falls, and falls are gonna happen. So we talk about safety, and falls are going to happen. That's the number one thing I think people think, oh, my mom's falling at home, so I'm going to move her into an assisted living or a nursing home. Well, guess what? She's going to fall there too.
Mhm. They're
It is,
not
it
a
is,
hundred
it,
percent
it is not
preventable.
going to, it is not going to prevent the fall. I hate to say that. It might make them less. They might be found sooner, but if they are, especially if someone that doesn't understand their fall risk, they are still gonna fall, and I hate to say that, but you wanna make sure because if they're not answering, one of the biggest falls is that call light goes on, they wait a couple minutes, and then they're gonna get up and take themselves to the bathrooms, and they're gonna fall. That's one of the biggest ones. Well-lit areas, nobody wants a dark, dreary place, and secure entrances and exits, especially if you have someone that's at risk of wandering with dementia. It's hard to find those secure units right now in nursing facilities. People are kind of doing away from them, but you want to make sure that they are safe and secure in those situations.
Or even that they just have alarms in place, if
Yeah, if the
a
doors
door
do open or they're
opens
answering the alarms. If the alarm goes off and you realize, hey, that's alarm is still going off 10 minutes later.
and
Well, that
Billy
could
Joel
mean
is
that Joe's
halfway down the
halfway down the
interstate.
interstate. Yeah. Yikes. All right. So, meals and nutrition. Whitney, you want to take this one?
Oh, food is important. For residents in long-term care communities, I think this is like the highlight of their day is meal times.
Mhm.
And any activities, anything extra that's going on. And I love food. I love to cook food. I love to cook food for other people. Um, if I'm going in to tour a building, I want to sit down and have a meal.
Mhm.
Cook for me what you're cooking for the residents so I can see if it's something that my loved one would be interested in or if your loved one that's with you is interested in it. So I think food is very important. Do they get an option? If my loved one comes here and they don't like what you're having, are they going to have an option to have something else? I think that's important.
I hope so.
Can they keep food in their room? Like, can they have a refrigerator or keep something in their room? Let's see. What do your menus look like? Menu options meet dietary needs and preferences. Do the meals look appetizing and nutritious? I think that's huge. If something doesn't look good,
You
you're
don't
not
wanna
going to
eat
want
it.
to eat it.
I happen to not be the best cook, and a lot of times my food tastes okay, but it looks atrocious. And
I don't think so. She makes the
um
best soups.
Boy, soup is easy. You gotta do is turn a crock pot. If you're trying to make something look good though, there's a Facebook picture that comes up every year that's it's like, hey, here's a memory. And I remember it was something I cooked for my son and he was just like, oh my gosh, mom, I am not eating that. Because it just looked so terrible. It was disgusting.
And our staff assisting the residents who need help eating. To this day, to this day, I cringe when I hear, oh, they're a feeder. They're a feeder.
I hate that word.
At my job right now, we have a board and it literally says feeders.
Mm.
And I'm like, okay, all right. I never say feeder. Oh, they're a feeder. I say
People
like
that need
this
assistance.
person needs assistance. We have to assist them for every meal. Um,
Why do they do? I mean, I just don't understand why people don't get that. That's not like we
it's
don't
to me it's very degrading.
we don't call them wetters or
Yeah.
poopers or
Well, got the pissers over here.
we
Yeah, it's
don't
very
call
degrading.
them by other
We go
problems, but we call them feeders.
feeders.
I just don't
Feeders.
understand why that one that's a term that
It's
people still hang on to.
for as long as I can remember though, it has bothered me.
I know. Well, that's because I taught you better than that.
Yeah, I don't like it.
I don't either.
Um,
Because it's labeling people by a need that they have, and we don't do that for most
for
any
anything.
other things.
Yeah.
We don't say, "Hey, that's a colostomy bagger,"
Yeah.
or "That's a catheter," or like we don't do that, but we
It's
call them
just
feeders.
dumb.
I know it's dumb. Anyway,
Anyway, sorry. That's just a pet peeve of mine. But when you're in a long-term care community, there are a lot of people who have to be fed. They can't feed themselves. So are those people being fed? Are they talking to them? Are they just sitting there shoving spoons of pureed food in their mouth, or are they engaging with them or trying to talk with them or making that experience a positive one for them?
Mhm. I think that the meals is the most important part of the day for them, because you can make it to where it's a really great meal or you can make it where it's bad. A couple things that come to my mind is, first of all, if you're in a senior care community or nursing facility, the lunch meal is going to be the main meal of the day
The
and
biggest.
the biggest.
Yes.
And some families are like, "Why? Dinner's the biggest meal," like or supper, or whatever you wanna call your evening meal, because that is our generation where that is the biggest meal. But if you think of yourself as a senior citizen, you don't wanna eat a big meal before you lay down for bed. So that's reason number 1. That's why you see that really light meal. But if you go in at 6 o'clock every day, 6 p.m., you might see, soups and little sandwiches and, it might be shoot, it could be a bologna sandwich or something you and I would look at and be like, "This is totally unacceptable." However, that meal goes through resident should go through resident council. That menu should go through resident council, and they kind of go over it and give them a copy of it, and they kind of talk about it. So typically there is a resident council that helps with the meals, and from there, that per resident request, usually that big meal is at lunchtime. So don't freak out if you walk in and see Cheetos on the plate at dinner time. Not to say that you shouldn't check and make sure that it's something fair, but it's not, um, it's not usual. It's unusual for you to see a big meal in the evening
Yeah.
time per the resident request. And then to me, this is a good time for activities and engaging staff because they're already there before or after the meal, and kind of try to keep them active and keep people's spirits up, because you're right. That is, if you feel good and everything else, you're going to enjoy that meal more. It's really hard to cook for 20, 30, 40, 50, 100, however many people on the same day. So there should be preferences, but know that sometimes, it's if you have a really picky family member, it's going to be a little bit of a challenge. Or if they have really, I just recently took care of someone that has that uh,
Alpha gal.
alpha gal,
Mhm.
and wow, is that challenging? Because that's new. I mean, it's not super new, but it's pretty new, and it's very can be very, very restrictive, and that makes it very hard to serve everyone else everything and this person nothing.
Right.
So those dietary see what those a lot of senior care communities, and we encourage, and I encourage it too, not to have really restrictive diets, because, if I'm 90 years old and I want to eat bacon, one time I got in a fight with a doctor one time because he said all we do is feed people bacon, and I'm like, if I'm 90 years old, you better just be feeding me bacon. I don't care. I don't
If I
care
want
if
the
I
bacon,
don't
give me
care if
the
my
bacon.
sodium and blood sugars are out of control. I want bacon. But you just want to make sure, be realistic. There's a dietitian that comes at least quarterly to most of these buildings, sometimes monthly, kind of depends on the level of care. And you wanna make sure that they're all engaged there, but really it's about, how does the meal look? Do they look like they're enjoying the meal, or do they look like it's a task that they have to do for the day?
And if they're super, super picky, that just might mean that you have to bring in their favorite things.
Mhm.
Join them for a mealtime. Bring them their Sonic burger and shake if that's what they really want, because I'm sure they'd enjoy that more.
Rooms and living spaces is next. Of course you wanna know, is there private or semi-private? What's the price difference if you're thinking of one or the other? Sometimes it's not that much more to go to a private room, and it's definitely worth it.
I struggle
Um,
with that one.
what?
Semi private and private.
Yeah?
I don't feel like anybody should have to share a room.
With a stranger?
Yeah,
No, I know, trust me. You should,
ever.
as many times as my dad's been in the hospital lately, it is, crazy for us to think of him in a semi-private room. As a matter of fact, my daughter went to the hospital this past year, and maybe I already shared this story at some point, but she went, and here's a 30-year-old woman that is having issues, and the nurse wants her to go to the bathroom on a commode when another lady is sitting next to her
In the hospital setting,
in
it
the
blows
hospital
my mind.
setting. And
Yeah.
I'm just like, "Are you serious?" And then the nurse like finally pulled the curtain, and she pulled it so much that Samantha sorry, Samantha, she's gonna kill me, but she's sitting on the toilet because she's having stomach issues, and she is literally can see her like see her lady in the next bed to her. And I'm just like, do we not have any dignity for ourselves that we would think that that is anywhat appropriate? The nurse was like a little, like what was it, Nurse Ratchet, whatever. She was so upset. She's like, "Oh, you cannot walk. You're dizzy." She had an inner ear thing going on. You're dizzy. You couldn't walk. She could walk perfectly fine. Yes, she was a fall risk because she was dizzy, but overall, I could have walked her, and we could have walked her
The
right
nurse
to the
could have
bathroom.
walked her
The
to the
nurse could have walked
bathroom.
her to the bathroom, but she insisted. I mean, how far away is your bathroom from your bed in the hospital?
Steps.
Insisted that she had to use a bedside commode
With a roommate.
with a
That
roommate,
could have had
a 30-year-old
that could have had
trying to have a bowel movement.
visitors
Oh my
in the
gosh.
room.
Oh yes. I was just like, this is most ridiculous thing I ever
And then
heard.
they come in and give report. So they're telling all of your information, your last bowel movements, what your poop looked like for the shift, all while your
Oh.
roommate and family is.
Oh, and now they have video doctors. So the video doctor is going over your whole health history and checking everything while the person can hear you.
I don't. But
Anyway.
yet HIPAA is such a huge, big ordeal.
Right. And that totally goes out the window. And I agree. So I agree. I think all rooms should be private, but we're not there yet. But definitely check into the idea that it could be how semi-private is semi-private in the setting, because it's going to be hard. You're not going to want to room with me. I can promise you that.
Well, and in a semi private room, you have less space. When you're moving somebody into a long term care community, you want that space to feel like home to them with their things, their furniture, their pictures, their blanket ladders, things that mean something to them from home. And that's hard to do when you split half of a room with another stranger.
Right. So and that goes into the next one. Are they personal touches allowed? Because you need it. If you don't, if you're get to the point where you're having to move into a nursing facility, you need all the personal touches around that you can have. And are they clean and have adequate storage and ventilation? Again, can they control their own temperature? That is
That's huge.
really, really important,
That's
because a lot
huge.
of
Yeah.
seniors are cold and they want warmth. And to me, I find it so, I'm a little bit crazy about this because I've been teaching this for so long that if a senior is cold and they want the heat on, they want the heat on. It's their home. I don't go in other people's houses and set their thermostat, be like, "I'm sorry, I'm visiting you for today, so we're going to turn the AC on."
People know when they come to my house, bring your coats
Yeah.
because we're like 68 all year round.
Yeah. So overall, you don't do that. But, in a lot of places you go to, like a restaurant that's super cold, it makes me so aggravated because I'm like, I'm your customer. I'm the one that you should be worried about. And workers, I apologize because I know that sometimes the aides are like sweating their rear ends off and everything else. But I'm just like, you're just in that room for a little bit of time and that person wants to be warm. If I'm in my room, I want my room at my temperature.
Right.
And so you
Well,
have to
that's how it
think
should
about
be.
that. Can they control their own heating and cooling? Because if they can't, that's a way bigger deal than you think it is. If they are on the same network as like a whole hall or something. And our bathrooms accessible and clean. Take a peek in that bathroom if at all possible. I actually insist on it because that is going to be, that is going to be an area that it needs to be clean. Activities and social life.
Are
Whitney?
things happening? When you walk in the building, do you see things happening? Are there activity calendars posted and available? Say you come in for a specific activity time and nothing's happening. Well, that tells me something. Of course, things happen, schedules change, things get canceled, things get moved around, but you want to see that activities are happening in the building. Who's the activity director? Can you meet the activity director? Talk to the activity director about what he or she likes to do, what's on the schedule. Talk to them about what your loved one enjoys doing. Is it something that they can incorporate into their activity calendar? Programs match residents' interests, opportunities for socialization and outings. I The older I get, I definitely become more of a homebody, but there are times where I'm like, "Oh my god, I have to get out of my house right now. I don't care what I do, where I go, I just need to get out of my house." And I can't imagine being stuck
Mhm.
in a long-term care community, or really stuck anywhere, home, and never getting to leave, never getting to go outside, never getting to breathe in fresh air, see the sunlight. I swear the sunlight changes me, makes me a different person. I just had a conversation with somebody the other day. Fall is here. Now, when I leave for work, it's dark. And when I walk out of the hospital from work, it's dark. And that is depressing to me.
Mhm.
Not having that sunlight, not being in the sun, not feeling the sun, it's hard.
Yeah.
So imagine being stuck inside somewhere all the time and never getting to go for a drive. One of my Facebook memories popped up a couple days ago of an outing that we took with several residents to Lone Oak Park.
Mhm.
And it made me miss the good old days. But it would be important for me that my loved one is getting out and doing things that they're still interested in doing.
And even for you as a family member, that doesn't mean that you have to even get them out of the car. You get them in the car, take them for a
Go get
ride,
a shake.
go get a shake, go through the drive-through, drive through Lone Elk Park. It's a little park we have here that has some elk, obviously. Um, just do something to get them out. And, that building should be willing to help you get them in the car and get it out of the car. And, if they're,
That,
if it's practical, obviously, if
yeah.
they require a lift or something, that's a whole nother thing. But they should have a van that has wheelchair accessible, and so that they could take your loved one with you. You might have to, hitch a ride to go, "Hey, this person's going to the doctor. I just want to hitch a ride and go for a ride to get out of the building."
Yes.
I don't really care what the reasoning is, but just getting out and breathing fresh air. And when you're there, is there an outdoor area and gardens? Are they growing things? There's no reason that there's residents that can't grow tomatoes and have their own little gardens outside or flowers. And you mentioned the activities. To me, if you go in at 10 o'clock and there's supposed to be bingo at 10 o'clock, and I know everybody laughs about bingo, but I tell you, senior citizens are serious about their bingo.
So serious. Yes.
There was a whole thing about don't just make it bingo. You know what? They would be happy playing bingo all day, every day. I hate
Yes.
to say that, but it's not something you can take away. And you definitely don't walk through and yell bingo if you don't have bingo because you'll get some things thrown at you.
Oh my god.
They're really serious about it. But if they're not doing it, just ask a question. Hey, where are they doing this bingo? Because they are required to create an activity calendar, and it should have all the dimensions of wellness on it, which we've talked about before. But overall, they're required. But are they living up to it? That
Right.
is that is really
Are
the
you
important
seeing
thing.
these things happening? And
Yeah.
again, reiterate, moving someone into a long-term care community doesn't mean you're just, for a lack of better term, dumping your loved one in this building and it's now their responsibility. It is still very much your responsibility as a family member to make sure that your loved one is living their best life and getting the best quality of care, and you still very much have to be a part of that.
Right. And because they would sometimes would rather stay in their room than go to activities and meet new people because they feel down on themselves. They're, here they've had to move from their home. Their health isn't as good. They're worried about how they look. There's just so many things. They're worried they're going to have an incontinence episode or whatever. There's so many things there, but having you there with them to attend those activities or encourage them to be at those activities or ask about those activities gives them enough courage and enough desire to wanna be involved in things that they would do that. The last 2, we talked about meals and activities. To me, the most important part of your visit, whether you're living there or just visiting or looking at it, most important part of everything. It's the quality of life that comes into that, and if you can't get engaged in those, I talked to a lot of people that's like, "Oh, I always eat in my room." You miss the socialization. "Oh, I don't go to activities." You miss the socialization. Those are the things that are going to create, quality of life,
Mm.
and that a lot of times we see when people move in, they don't want to participate in those, and they're not going to make the best of that. So make sure that you're part of that. And you know um, one thing that isn't listed directly here, but it goes into resident interest, is having a church service or Bible study or something there. If they have keeping their faith is really strong. A lot of our seniors have a very strong faith and want to still be involved in church, and that's one of the things that start bothering them when they're at home. And so that's one of the reasons we picked the place that we picked recently, for the one I was looking at, is because that church actually went to that location. And so that's important to make sure that they have, that dimension of wellness of having their spirituality exercised in their home that they live in now.
There's so many things that go into this, and it just brought me back to that poor family from yesterday who had less than 24 hours to pick somewhere
Hmm.
for their loved one to go.
Yeah, you can't even tour all the buildings that you need to
No.
tour in this area. Which goes into the next one, family involvement and communication. To me, this is the what makes family be able to go home and sleep at night, which is I've mentioned before, is how involved are they? Sometimes we have family members that kind of want to stick their head in the sand and they don't
Mhm.
want to face it. They don't want to. It's sad to go. It's sad to be there. It's sad to see the decline, but um, it can be better if you're more involved. There are things that's called care plan meetings. Go to every single one. If you have a doubt, request another one. Like, the more you can be involved in the planning of that person's care, the better you're going to feel about what's happening there. And it might be that you have to do it often if you have a lot of concerns. But overall, what kind of meetings do they have? And are staff responsive to questions or concerns? They don't, not everybody has the right answer. You're going to see people all the time. And a lot of times, those are going to be the aides. And you're going to want to ask them a lot of questions because you know them. They don't always have the right answers. Not that they're not very knowledgeable, great people, but sometimes you need to make sure that you take it to the appropriate person.
Right.
Sometimes the nurse needs to answer that question or the administrator needs to answer that question. So be mindful that, what question are you asked? Did mom go to the bathroom yesterday? Well, that's a good aid question. Did mom get a shower yesterday? That can be a good aid question. Did mom's doctor change the medicine? That's a nurse question. When's the family meeting? That's a admin question. So just be mindful of what you're doing and visit at all hours, to make sure that you know what's happening around the clock. Because the one thing about seniors, sometimes they really, well, I was just talking to this family, and there's happens to be, or we can talk about my family or this other family. There's four kids in both situations. There's four children. It might be that two children or three children visit every day, all day long, all the time. But that family member is looking for the fourth child. If they're all still living and able and whatever, don't just count yourself. Don't think, oh, my sister's there, she's handling it, so I don't need to be there. Um, all family needs to be involved. And because the reason I say that is because sometimes it can be like, oh, nobody comes and sees me. We actually have a little joke that my sister's called nobody, I'm anybody. I think I might have shared that before, but because my parents will say, sorry, mom and dad, I'm throwing you under the bus again, but my parents will say, no, nobody comes and visits us. Well, I visit all the time and my sister visits all the time. So we call my sister nobody and I'm anybody. But really, they're looking for their son, that doesn't visit as often, and or their friends that they've been friends with forever, and that's the case where um, families need to be involved and set. If you don't want to be involved in their actual care, be involved in just visiting them. Just go by and have a quality visit. So I think that's more important than each member of the family always realize. And again, it's a lot of times it's the daughters, and sorry, men, but it's the
Just
daughters.
the natural
It's a natural thing,
caregivers.
but overall, I know, I'm very close to my daughter, but I'm also my boy is my baby, And I know when I'm there, I'm gonna be looking for him just as much.
Yeah.
All right, quality and reputation.
I
Good.
think picking somewhere I would definitely wanna go off of a personal experience. Like, I know someone who has been there, who has lived there, and had great things to say about it. So, having a good reputation in the community would be, like, at the top of my list for somewhere that I would pick.
I'll tell you what I just did is I went in and interviewed residents. Um, I've sorry to the administrators that have to deal with me, but I actually went in. I knew a couple that lived at one of them, so I just went in, went to that couple's apartment, knocked on their door, asked them if I could talk to them, and sat down with them for probably a good hour and visited with them about what their thoughts, food, activities, staff, everything. And then I went to the next location and I did the same thing. I happened to see people I knew coming in and out. So I just stopped them right in the parking lot and asked them everything I could ask them in the few minutes, and ended up probably visiting with three different people and for over an hour time period about everything about the other location. So I just asked it. I didn't. I really kind of skipped the administrator's office and went straight to the people because I want to know
Right.
right from the inside, what's it seem like? So I totally agree because, even a bad reputation, something can happen to a big person and you might have someone that's carrying on, things happen. Again, we're people taking care of people, things happen. So, you really just wanna be able to get as many details as you can about things. CMS star rating, so that is for skilled nursing only.
Mhm.
You can go to medicare.gov and compare nursing homes, and there is a star rating from 1 to 5. Obviously, 5 being the best, everyone wants a 5. It's really hard to get a 5. One little boo-boo, one little the harder residence that you have, the lower your rating could possibly be for quality measures because, if you have urinary tract infections or dehydration or pressure ulcers or anything like that, it's supposed to account for the fact that if you admit them, but it gets a little difficult at times. So, if there's any kind of you do assessments on in skilled nursing, you do assessments on residents, and there's journals and payroll journals and different things that go out that tells Medicare um, how you're doing. And all their resident assessments go to Medicare, and they put it all together in this, and they create this 5-star rating, and it's based on state surveys, these quality measures, and staffing is the number one thing. Turnover, there's lots of different things that go into each one. And, if just because they're not a 5 doesn't mean that they're not a remarkable building.
Mhm.
Just because they're a 2 doesn't mean that you can't get good care. There it is obviously you want to lean towards the 4s and 5s. I mean, there's just no way to say that there's no way to say it because that means that it's better, but it could mean that they take
Less acuity.
less acuity
Yeah.
and less risk. They don't take risk that there's, people are higher, higher functioning, and so that there's less decline happening, and, when you're taking care of 80, 90-year-olds, there's obviously gonna be some decline. So you just really have to look through. You can dig through each one of those, and if you ever need any assistance with that, we'll be glad to help you look over and tell so we can see what it says. But if you go into each one, you can read their state inspections almost to the T. You can see if they've had fines related to, if you have a fine, that means that you had a kind of a nasty tag, or you didn't correct a tag. Like if they, it could be that you set they found a tag and they that you a deficiency practice, and they came back and you still hadn't fixed it in a way that they found acceptable, so that they fined you or took away your funds. So there's lots of things about it, but overall, you want to dig through every one of those categories and find out why they have a if they don't have a 4 or 5, why do they? Don't toss them out the window because they have a 2 or 3, but just know that there's
Yeah, if they have
concerns.
a 2 or 3, do your research and figure out why it's a 2 or 3.
If there's a 1, yeah, there's probably an issue. But I will tell you, and sometimes it's not cut and dry because based on my experience, and this might be a very unpopular opinion, but a for-profit and a not-for-profit are getting inspected differently. And I hate to say it, but I see where there's a lot of non-for-profits that are higher up on the list, and I would not pick that location at all. Um, I'm not saying that's true. I'm not saying that that's just been my experience in a couple locations that I've seen that there is the non-for-profit is maybe, being a little, getting a by with a little bit more. Or if it's a government run, building. I know, oh my gosh, I just totally went out there in left field, but it's just there's a lot of if, ands, or buts about it. So do your research. And again, read the state surveys, results, and some of them are pretty ugly. Like, if I'm there to inspect a survey, I'm like watching, let's say I'm watching a call light, then you're going to see on there, call light on at 2, call light on at 3, call light on. This aide walked by, this aide walked by, this aide walked by. They are giving you details that are going to scare you. I hate to tell you, but they're scare you. But I've seen those. I've had those tags where it's like it's reading and it's like, oh my gosh, I can't believe we did this. But if you imagine you're busy, if you think about how busy and crazy things are, there are times where people walk past a call light. I'm not saying that they should ever, never walk past a call light, but the state surveyor also doesn't understand that there might be someone that's having shortness of breath down the hall, and that becomes more important than someone that needs a Kleenex. So it's very hard to determine that based on that data. But no, when you read those state surveys, sometimes they're kind of scary to watch. So kind of scary to read. And that they don't have any serious violations or complaints, like someone reported abuse and it wasn't investigated. That's a pretty significant,
Mhm.
that would be one. Or we talked earlier about emergency protocol where someone needed CPR, didn't get CPR. Those are some pretty significant ones that you can see and where you would see that it would affect their star rating.
That
Online.
leads me into a whole other topic.
Oh, yes, go ahead.
Just my take on it, but there aren't, really a lot of 80, 90-year-old individuals that should be going into long-term care communities
Needing CPR.
being a full code.
Yeah,
So
that
I
is a
think
whole
a
nother
lot of
topic.
that is education
Yeah.
on what we're actually doing for that individual when we are giving CPR. And I've had many people say, yeah, you can give me CPR, but you can't intubate me. Well,
Well,
the 2 go hand in hand.
yeah.
If you're getting CPR, you're unresponsive and you are getting intubated.
Yeah.
So I think it's just a lack of education.
Hmm.
But there shouldn't, I don't know any 90-year-olds that wanna be a full code.
Yeah.
Usually when you get to a certain age, you're happy with your life and you're okay. When it's your time to go, it's your time to go.
And I see a lot of families are just worried to be the one to put that on the piece of paper, and
Yeah.
it's like, yeah, but again, it goes back to quality of life. What is your quality of life at that point? All right, financial and admission information. Overall, do they accept Medicare, Medicaid, private pay? If you're getting in the skilled, a lot of times you're getting in the Medicare and Medicaid. Less private pay, but of course they are out there. But overall, you want to make sure that they accept whatever your payer source might be and evaluate each one of those. Transportation and all fees and extra costs. You do want to find out what are the extra costs. They should have transportation. A lot of times it is covered, but you want to find out, what is that look like in case you have someone that needs to be, you're like, where do they really need to go? The doctor should come there, but what if they need to go to a specialist or something and they are wheelchair bound? You want to make sure that you kind of clearly know those different things. And is there any help? There should be a social worker that is available to help with any of your insurance or Medicaid applications. They are complicated. They are not easy. They are not there to like say, "Hey, we really want to give you Medicaid monies." You have to really know the system in order to be able to make sure that you can get the application. Because if, like, let's say, one of the things is if you have $2,000. Well, if you have $2,000, you might get declined, but if you have $1,999, you might get approved. You need someone that is an expert that knows these things, that knows that you wouldn't want to spend the freaking dollar. Go get a pack of gum, and you
Right.
can get approved for Medicaid. But
And it's all very overwhelming when you
Yeah.
see it, when you're approached with it, but there are resources out there and there should be people at those buildings that can
Help
help
you.
you fill out all that paperwork and put your mind at ease.
Yes, absolutely. So, questions to ask during your visit. What kind of questions would you ask during your visit, Whitney?
The emergency one was a big one. The first one that came to mind, like how do you handle emergency situations? Um, Turnover is an important one for me because I want to know that my loved one is getting consistent care, and able to build those relationships with consistent people. And are
Mhm.
those people happy? Are your staff happy? If they're happy, I feel like they're going to stay. If they're not happy, I feel like you're going to have probably
Right.
a pretty high turnover. Um, how are medications managed? This would be a hard one. Like if I'm taking care of my loved one and I'm the one responsible for their medications, like you are for your dad, how you get all of his medications ready for him, that would be a hard one for me to let go. There's a lot of medications, a lot of silly errors that happen with medications.
Right.
Giving someone digoxin when their heart rate is 40,
Right.
or giving someone a little too much insulin because you didn't know how to read the insulin syringe. So,
Well, with my dad, they're going to be jacking up his water pill every other day because they're gonna weigh him every day and he's gonna be different every day, and they're gonna be like, "Oh, here, we're gonna increase your Lasix." Nope, never mind, you're too dry, now we're gonna have to like, it is literally a very, very fine line that I will 100% sorry in advance if I'm hoping it never happens, not that I have anything against, nursing facilities, but I'm trying really hard to take care of my dad at home. As I said, we're in the middle of building an apartment for him on my property and, both of my parents. Um, but it would be something that I would be like, "Do not change that until you talk to me."
yeah,
So
that would be a hard one for me
if
to let
you're
go.
if you're, if you know that your parent is really sensitive, that's something you're really gonna have to keep an eye on, and it's okay to tell them if you make a change, they're supposed to call you if they make a change, but sometimes they don't, and that kinda goes from there, and then you just have to know, what does it look like? One thing about medication management is the packaging. So that's something that a lot of families I don't think about is the packaging of it. You just go to your local drugstore, you might do mail order, but a lot of times we package it specifically in senior care. So it can be given easier. It's either bubble packed or it's in strip packaging now. Very efficient. Of course, it has some withdrawals because you can go through and like pop, 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 and without looking at a MAR, you know, if I was, quite frankly, if I was really thinking of placing someone, I'd probably stand back and watch how they do it. Are they looking at the MARs? Because, um, these days, it used to be you had to look at a piece of paper and you had to look at the thing and you had to look at a piece of paper and look at the thing. But these days, they have them so packaged in a way that you could just open up a pack and dump all their pills in there and go. But if they happen to have their, let's say, Lasix or digoxin, um, discontinued yesterday, it would still be in the packaging and they'd have to get that out of that packaging. And
Right.
if they didn't, it could easily still be given. So I'd want to find out, are they actually comparing everything like they're supposed to be comparing? Because that is probably, um, medication errors is probably way higher than we would ever want to
Right.
admit. So,
So that would definitely be a hard one for me to let go.
mhm. Um,
How do you handle falls or emergencies? We talked about that a little bit. That's a hard one too. And I guess maybe it's just because we're nurses and we're in the medical field, and there's a lot of family members that don't have a healthcare background. But when somebody falls, like I know exactly what I'm looking for. But is somebody that doesn't have a nurse background gonna know what to look for? So how do they handle that?
Well, overall, when you fall, you wanna, how are they getting injured? Of course, we have to deal with the injury first, but the main thing about a fall in any setting is from immediately that time of that fall, you're supposed to be implementing something different in order to prevent that fall. So there becomes an investigation. And in that investigation, like, why did they fall? Were they waiting to go to the bathroom? Do they fall every day, or multiple times a week, or often right after a meal? Like, they're going to leave the dining room and they're going to um, go put themselves on the toilet and they're going to fall. That is the things that the building is responsible for tracking, and the families can track too. Hey, I know what time did this fall, and that's the investigation that sometimes is a little hard because if you're I mean, I'm just being honest. If you're taking care of 50 people and 50 people are falling, it might get lost in the pattern of it. Depends on how the software system and if they have reports that spit that out for them, or they have to really go in and dig into each one, which they should. But overall, I you can track falls pretty regularly and see what's happening. Are they falling same time? Are they falling same place? Are they falling with the same staff member? What in the world is happening? And you can typically see a pattern. Now, the really bad part is if you have someone that has dementia or no safety awareness, doesn't know that they can't walk, doesn't know that they shouldn't be doing something, they're going to do it over and over and over again. They're going to fall over and over again. And finally, you're like, I don't know what else to do. We used to restrain everyone, to be quite honest. And, it got to where the restraints had greater risk than the fall. And I hate to say that, but that's where some of it is. And there's probably a fine balance somewhere in the middle. But it's hard to find that balance because, you have to really trust and rely on the staff to find that balance. But overall, as a family member, you're going, okay, so what do hey, my loved one falls. What are you going to do about it? What does it look like? What does your policy look like to you? And they should say, well, we're going to assess them and make sure we're okay, and we're going to determine what's going on. Then we're going to investigate why the fall happened, and then we're going to implement something new in their care plan and train all the staff on that um, new implement what we implemented, in order to prevent the fall from hope to prevent the fall from happening again. Doesn't mean it's going to. It means we're going to hope to prevent it. And there's so many things. There's mattresses with beveled edges. There's, side rails is not something with there's too many risks associated with, side people hanging from side rails. And I know that sounds graphic, but that's the reality of why you do not see long-term care communities with side rails anymore. Um, but overall, you wanna know, there's special chairs, there's alarms, there's special cushions in their seat. There's mainly is, take them to the bathroom. Soon as you see them leave the dining room, if you know they're gonna go take themselves to the bathroom, then your staff should be like, "Ding, ding, 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 ding. It's 1 o'clock. We know Whitney is taking herself down to the bathroom,
She
and we be
just ate. She's got to poop.
we better get down there because she's
Yep.
gonna beat us to the floor." And, overall, those are the things that they have to be responsible for in order to prevent that fall and whatever it looks like. Um, you have to put things in a way that they don't have to reach or grab or whatever if they're wheelchair bound or their walker is goes too fast, goes too slow, like there's 1,000 reasons of why they could fall, and their job is to investigate it. So their answer should be, after I make sure your loved one is okay, I'm going to investigate why they fall, and we're going to implement something new, an intervention to try to prevent the fall. And your job is to help them with that and try to figure out, hey, you know what? My dad got up every day at 5 a.m. So even though you're not going in there to get him out of bed till 6 o'clock, he knows, ding, 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 it's 5 o'clock. I need to get up and go to work. um, then that knows at 4:45, I better beat him to it, and I better go ahead and say, "Hey, are you" walk in there and say, "Are you ready to get up?" And I better get him at 5 o'clock because he's gonna get up at 5 o'clock,
Right.
whether I want him to or not.
That's going to be me.
Yeah. Not me.
And I want my coffee.
Not me.
Make sure I have my coffee.
So that kinda covers some overall, and the last notes of this is just, making some notes about your overall impression. Again, don't it's not instant. First impression, absolutely, that was the first thing you mentioned, but you just gotta dig into the details. One thing that we didn't look at is location. We do not have location on this list, and I think that is extremely important because the best one that fits all of these categories might be the next town over or 2 towns over, and that's okay as long as you can still visit.
Yeah.
If you know you won't go visit because it's 20 minutes away, then you better go with the one that is in your town and so you can visit every day. It
So you can be there
really
more.
it is your interaction as a family member is more important than probably most of the things on this list. And I'm not saying you should go to the dumpiest of the dump, but overall, let's say the spouse is still living and still drives, but can't drive 20 minutes away. She can only drive in her hometown. Then overall, maybe she probably shouldn't be driving if she can only drive in her hometown. Um, but overall, the quality of life is going to be better if that person can visit every day.
I
So
agree.
that is one thing that we didn't list. But any concerns, follow up questions, and just overall, where do you feel, how that, there's some basic questions on here, is a quick decision summary. Do staff seem genuinely caring and competent is probably the number one of those questions because it's really all about the staff. It's really not, it's less about the administrator, less about the director of nursing, more about the people that are providing that
Doing the
care.
care. Yeah.
However, they are being led by that person. And if they do not have a good work environment, they can't do these things. But overall, you need your staff to be caring and concerned and competent.
Yeah. Very overwhelming experience. There's a lot that goes into it.
Mhm.
But there are lots of resources. And again, the more we talk about this, the more my heart breaks for that family
Mhm.
yesterday. And I I know you are a resource. I can be a resource to help you during this time. And
I think,
it's
the last thing I wanna say is don't wait for the emergency.
yeah,
I wonder if the family yesterday, if they, had waited for the emergency. I don't know the family, obviously, but, a lot of times we wait. We wait until they fall and break their hip. We wait until they have pneumonia. We wait until middle of winter.
we
We
wait
wait,
for
we
the crisis.
wait
Yeah,
for the crisis. Prepare. And that way, if you wanna wait at home for the crisis, at least you're prepared. I know which location I wanna go to if I have to.
right.
If your mom is falling at home multiple times and one of these times, currently, I can talk about my dad. My dad fell 8 times in 1 week. And I know I'm the nurse, I do long-term care, and my dad falls 8 times in 1 week.
But they're not preventable. 100% preventable.
Well, he
Even
has
at
very
home.
poor safety awareness, and he is not dementia, he just ornery. Um, but overall, that's my cue to say, I should be ready for this crisis because one of these times he's gonna bust his head open or he's gonna break a hip. And when he does that, I need to know where I'm gonna take him. I know where I'm gonna take him, um, so I don't have anything to worry, but if I didn't know anything about senior care, I would absolutely,
It
have
would be devastating.
it would be devastating
Yeah.
because I'd wanna make because
For it to just be sprung on you.
you do
Like,
not wanna make this decision last minute.
yeah,
If I can ask of anybody anything, do your education, don't make this last minute. Don't have to be forced to make this decision in a 24-hour time period. We know it happens. But from the moment they say, "Hey, you might have to do this." Let's say someone has a stroke, which comes very unexpected.
very.
Um, then the moment that you know that that stroke's happening, you need to start thinking about it. And I know families don't want to think about these things. They're dealing with this crisis, whatever, but you know that overall they're going to keep them 3 nights. They'll keep them 3 nights typically because they know that they how Medicare works and stuff. And those 3 nights, you got to start doing your homework with hopes that you won't have to use it, but being prepared to use it.
Right.
So,
Just having that education and that knowledge of what to look for, I think will really help.
yeah. So if you have any other questions, feel free to reach out to us. We're always glad to help. Always glad to give any other advice and look up any of the communities that you would think that you'd be interested in. And of course, our checklist is available on our website at www.nurseleadershipsolutions.com.
Yep.
And we look forward to talking to you next time.
Bye, guys.
Bye. Have a great day.